what you think the global north can learn from the global south, because there are a lot of African solutions that we have, especially within the mental health space, that has been working. And this is something that could be a learning curve or a south to south learning opportunity. What would that be from your end as we wrap up?
Yeah, I think one strong thing that the global south has to offer, especially when it comes into mental health. Health generally had not been considered an independent, had not been viewed from an independent lens, but from a societal lens. And when we talk about societal lens, is that people had always a fallback plan. When you have an issue, it is not only your issue, but it's actually a community issue. Now, when we are talking about a digital space, if we can actually inbuilt digital communities of practice where people will come into a digital space not as individuals, but join a digital community of practice that they are actually able to feel when I'm in this space, I am within a community where people are also able to share their own personal stories. It actually gives me that measure of belonging and feeling that my problem is not mine alone, and that an algorithm or someone somewhere is simply just pumping in solutions into my head, but I'm actually reading from an experiential point of view where others are also equally sharing their experiences, telling me that, you see, this problem, so and so had a similar I had the same problem, this is how I dealt with it. For me, a similar problem, this is how it was dealt. It brings people closer to reality that the issues they are actually facing are not too personal to them, but they are actual issues that actually other people also face, and they have a way that they have already dealt with them. So if we can inbuild this sense of community and create
Yeah.
digital communities of practice where people will not only interact with either AI responses that are so individually customed, but actually provide a space where people kind of engage in a digital community of practice space. I think that would be a real good thing in using the digital health spaces to support people, and that's a good learning from the global south. Thank you.